As we are learning about the reproductive system, take note that although the book says this is the only system that is not essential to the life of the individual, although necessary for procreation, I kind of have a little bit of issue with the fact that this is what is written in the textbook, because technically it may not be essential to life. However, in working with patients who are struggling with infertility, I have seen the massive destruction it has done to people whenever they do have problems in their reproductive system. And then it leads over into other issues like depression, anxiety, etc., that do affect the quality of the life of the individual. So it's hard for me to completely agree with that statement because of what I've seen in clinical practice. So the book says this does affect other systems, kind of like I was just saying, and so if we look at true health as a component, a triangle of three different sides, it's important for you to understand that those three different sides represent what it means to actually truly be healthy. So I'm going to get into that triangle of health in the next slide, and I want you to just keep in mind that when people say something is not essential, I can easily argue that by looking at the triangle of health because of the essential aspect of mental health. Male and reproductive organs will produce and store specialized reproductive cells that are going to combine to form new individuals, and they're also going to secrete hormones that play major roles in the maintenance of normal sex function. So here's that triangle of health, and this is one of the things that I certainly want you to always remember, not only for this semester, but just for the rest of your life as you are talking to people, whether it be your own patients or people who are in your family, your friends. Remember, we're learning anatomy so that we can be of service to others. When you look at this triangle of health, what this is saying is that you have to have the three sides come together in order to be truly healthy. Health is not the absence of disease. That is not what health is. Just because you don't have a diagnosis of something does not make you healthy per se. So when you look at this triangle, what you're going to see here on the three sides, you have the nutritional or the biochemical. So those are the things, of course, that you're eating. What are you putting into your body? What are you exposing yourself to? What kind of toxins are you around? What kind of water do you drink? All of those things really matter. Do you smoke, etc., etc.? The emotional and mental side is one that does not get talked about very much in Western medicine here in America. We have an unprecedented problem with people who suffer from emotional and mental distress and feel like they cannot talk about it because there is a stigma behind it. For many, many, many years, I heard a lot of people say, I'm not going to see a psychologist, or I don't need a shrink, or I don't need somebody telling me blah, 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 blah. Now, what has come from that basically is we have more people than ever who are high suicide risk, or actually people who do follow through with suicide because they feel like there must be something wrong with them because they don't think that other people feel that way, and so therefore they have a problem, but it cannot be discussed openly because there is shame and guilt that is surrounding that, and that is absolutely not the way that it should be. We should be able to be open, and we should be receptive to people whenever they are saying, I am struggling with ABC, XYZ. Absolutely nothing wrong with having emotional or mental stuff that you have to work through. That's a part of life, and every single one of us needs to be able to say, hey, I understand and I get it, and I'm here to help, especially if you're going into healthcare. If you're going into healthcare and you're not going to address the emotional or mental component of your patient's health, you're missing a third of what they actually need from you. Now, the structural and the physical is what we usually focus on in Western medicine because it's very easy to see and or measure. So because we can quantify these things, we tend to want to stick to those things that we can actually say, well, this is this, like this temperature is 98.6, this blood pressure is 120/80, this BMI is, you get my point. So just because we can't quantify something on the emotional side doesn't mean that it should be ignored. We can quantify structural, physical, we can even quantify nutritional, but that's when we do our things like the blood labs. But it's harder to quantify what's going on inside of a person's brain because they do have the ability to lie about it, or they have the ability to cover it up so well. So it's very, very important to learn the psychology behind human behavior, especially if you're going into healthcare, so that you can understand how best to assist all patients and look for those red flags so that you can maybe be the person that can help turn things around for that individual patient. So even though the book says that the reproductive system isn't essential, if somebody is willing to take their life because they feel like, I am not able to have a kid and I'm not able to give my husband what he wants, what kind of person am I, why should I be here, I have no reason to live. Well, at that point, that reproductive system becomes very essential to that person's life. We've got to work out the emotional components, but we also need to help them fix what's going on in the pathological processes of the reproductive side. So I know that that's kind of a little bit expanded beyond this particular level of class, but if you do more looking into this triangle of health and understand how the components all work together, you're going to put yourself in a better position above your colleagues to be able to better care for patients, which is going to look better on your resume and your skill set. So anything that you can do to give yourself an extra edge is always going to be beneficial to your long-term goals as well. All right, so back to the reproductive system. This ensures continued existence of our species, obviously, because it's necessary for procreation. The reproductive structures include the gonads. So these are organs that produce gametes, as we learned when we went through briefly in the endocrine system about the gonads and the gametes. We're going to have ducts that will receive and transport those gametes, and then accessory glands that will secrete fluids into those particular ducts. The perennial structures are collectively known as external genitalia. So those things that you can see from the outside of the body, you do not have to get a scope and look in something. You do not have to go internally. Anything that's external is going to be what we refer to as a perennial structure. The reproductive tract will include all chambers and passageways that connect those ducts to the outside of the body. So a lot of activity is going to happen on the inside, and then of course things are going to have to somehow come out. Obviously, if we have a baby, it's going to have to come out. If a sperm is made, it's going to have to come out. So we'll be talking about how all those things happen. The male and the female reproductive systems are functionally different, and you will learn that the females produce only one gamete per month. This is ultimately going to be what will help with nurturing that new baby, and then the males will produce large quantities of gametes, so they can make up to 500 million sperm every single day. Timeline is also going to be different for males and females, so as we go through spermatogenesis and oogenesis, you will also see that both of those processes start and end at different times within the male and the female's life. The male reproductive system, the gonad, is the testes, and this is going to secrete male sex hormones, as we've already learned, called androgens. Testosterone is going to be the most important one, and then they will produce the male gamete, which is known as sperm. The female gonad is the ovary, so again, every single month she'll release one oocyte that may eventually become an ovum. We'll talk about how, when, why, or why not. And then she's also going to produce the hormones such as estrogen, progesterone, etc. The uterine tubes are going to be the structures that will carry the oocyte to the uterus. If the sperm reaches the oocyte, then we can have fertilization. if we have fertilization, then that oocyte will mature into an ovum. So although it's usually commonly termed the egg, which is what ovum means, although it's usually commonly termed that, she's not actually going to release a true egg every single month unless fertilization happens. So there's some pretty specific details that we'll walk through when we go through the oogenesis so that you can learn the difference in what's going to happen if fertilization occurs versus if it does not. And remember, fertilization is not implantation. So just because fertilization occurs does not mean a pregnancy will occur. The uterus encloses and supports the developing embryo, so that is going to be baby's home for the 40 weeks is the uterus, and the vagina will connect the uterus with the exterior portion of the body. So baby lives in the uterus for the 40 weeks and then hopefully is born vaginally. Development of genitalia. So when we're looking at the embryos around 5 to 6 weeks of development, they're what we call sexually indifferent. The gonads and the other reproductive structures are going to be similar in both males and females, but that genetic makeup will determine whether you get a male gonad, which is a testes, or female gonad, which is an ovary. So the embryonic testes will begin secreting testosterone. If that testosterone is there, because that's what the genes are coding for, then the male reproductive system will develop. But if there's not testosterone, then those female structures are going to form. So if we look at a picture, what you're going to see here at 4 weeks and at 6 weeks, you've got this opening, you've got a genital tubercle, and then you can even see on the 6-week picture the anal fold. Now, that genital tubercle will develop into either the penis in males or the clitoris in females, depending on the presence or absence of the testosterone. This is why it is also extremely important when mom gets pregnant for her to stay away from endocrine disrupting chemicals or drugs. So we want to make sure that baby has the ability to develop properly and that hormone signals can be read appropriately in order for normal genital development to occur. When you look at this picture here, what you see is what's going to happen with the development of the male genitalia under the influence of the testosterone. So at 10 weeks, the tips of those urethral folds start moving together and they form the spongy urethra and the scrotal swellings. So what we're getting here is we're getting, instead of a genital tubercle, the development of that penis and the scrotum. You can see in the little comparison chart that the penis is homologous to the clitoris because both of those are going to come from the genital tubercle. If we're going to get a female, because of the absence of the testosterone, now you see what's going to happen. The genital tubercle will become the clitoris. The urethral folds are not going to fuse. Instead, they're going to develop into the labia minora. So the genital swellings form the labia majora. So the larger lips on the outside, thinner lips on the inside. So we've got some differences in structures here by the time we get to a later development phase, all because of that testosterone. When we're looking at the descent of the testes actually form inside the body cavity close to the kidneys. Now the kidneys are in the low back. Testes, when baby boys are born, should not be in the back. They need to be outside of the abdominal pelvic cavity. There is a structure that's called the gubernaculum testes. This is a cord that is only present in the fetus. It is connective tissue fibers, and this helps lock the testes in position as the fetus grows, but it also helps with that migration of the testes into the scrotum. That's where we need the testes to go. We don't want them to stay in the back. They have to go down into the scrotum. Improper function can lead to that retention of the testes. So here's a picture where you can see the testicular descent starting from the 2nd month of development. You can see the gubernaculum. You can see the testes, which are going to be in the low back area. As the 3rd month progresses, you can see the testes are starting to move inferiorly. 7th month, we've got them further down, and then by the newborn time, now we have the testes within the scrotum. That is the goal. So we do want that migration down from the low back area into the scrotal area. Whenever you look at the growing fetus, it is those circulating hormones that will stimulate the contraction of the gubernaculum testes in order to help move that into the scrotum where it should be. The descent process is still talked about, still debated, not completely understood, so that's just a very big forest picture on how that happens. Now, what is it called if it doesn't happen? So cryptocortism is the word for undescended testes. There's different reasons why this can occur, everything from prematurity to hormonal disorders, even testicular absence. But good thing is that more than half of the males who are born with cryptocortism, this will self-resolve, usually within the 1st year of their life. If it does not, then they may need to have surgery in order to move the testes into the correct place. Men with undescended testes are more likely to develop an inguinal hernia, where the intestines will push out through the abdominal wall. I'll show you where specifically in a few slides. Surgery is necessary in order to correct this. Undescended testes are also a risk factor for fertility problems as well as cancer, even if it's corrected, which is unfortunate and sad. So you just need to be aware of that. This is why good health history is pertinent and very important whenever we're dealing with our patients. We want to know what happened in the past so that we can address any issues that may potentially affect their future. The spermatic cord is going to be the structure that extends between the abdominal pelvic cavity and the testes. So this is layers of both the connective tissue fascia as well as muscle, and it will enclose different structures like the ductus deferens, which we'll talk about, blood vessels, nerves, lymphatic vessels. All of these are going to be within the spermatic cord in order to maintain homeostasis within the testes. Each begins at the entrance to the inguinal canal. So that is in red because that inguinal canal is incredibly important in males. This is the passageway through the abdominal musculature. If you look at the picture in just a minute, make sure that you remember that inguinal canal. That is incredibly important structure because that's where we're going to talk about that inguinal hernia. The blood vessels of the testes include the deferential artery, the testicular artery, and the pampiniform plexus of the testicular vein. It's very important that obviously it gets blood supply so that it's nourished, but also for temperature regulation as well, which we'll talk about. The nerves of the testes include branches of the genitofemoral nerve from the lumbar plexus. Here is a picture of our inguinal canal. So you can see that it is that structure that it has kind of like a circle around it. If you look at this picture and you move your eyes superiorly to the inguinal canal, what you see are some blood vessels, and then you can also see some muscles. What you're not seeing is the fact that they have removed the intestines. So the intestines would normally sit right there. The inguinal canal is a weak point within the males, and it is very important for males to not start weightlifting too early, because if they put too much stress on this inguinal canal and they weaken it and the structure doesn't stay formed and tightly adhered like it should, then it is possible for some of those intestines to slip through that little canal, at which point they will get that very painful inguinal hernia. Now, some people who do intense weight training also have suffered from things like this from lifting too much weight, because it is that weak point, and putting too much pressure, bearing down too hard can be problematic. So do have to be aware of that in males. The spermatic cord, as you can see there, again, arteries and nerves, blood vessels that are going to go down into the testes in order to help regulate homeostasis. Make sure that whenever you're looking at this picture, you can see that the testes is not the same as the scrotum. So don't get those two confused. The testes lives inside of the scrotum. So the scrotum is just the outer sac, whereas the testes is the actual gonad that is inside. It's going to be covered by a protective layer of tissue called the tunica vaginalis. And so that is going to help with making sure that everything is protected and well cared for. You can see that there's also going to be other layers of muscle as well in a few slides whenever we get. Oh, here we are. Dartos muscle, layer of smooth muscle within the dermis of the scrotum. So this is the muscle that causes that scrotum to be very wrinkly. In order to remember this, I always thought about old man Dartos. So just, an old man with very wrinkly scrotal sac. Think about old man Dartos, and in order to help you to remember, this is the smooth muscle that causes that wrinkling, whereas the cremaster muscle is skeletal muscle. So this is deep to the dermis, and this will allow the movement of the testes. So if it tenses the scrotum, it will pull the testes closer to the body. This can be because of sexual arousal or because the male is cold. It is very imperative for the testes to maintain a very specific temperature, so the cremaster muscle will tense to pull the testes closer to the body if he gets too cold, so that the body heat can help warm the testes. Now the opposite is going to happen if he gets too hot. The muscles are going to relax so that the testes can move away. So if he goes to the beach and it's super hot, then his cremaster muscle is going to relax so that it cannot be near so much body heat and remain cool. It is necessary for the testes to stay about 1.1 degrees Celsius lower than normal body temperature in order to have normal sperm development. Some of the issues with infertility are males who do not have proper regulation of their testicular temperature, so therefore sperm development cannot occur normally as it's supposed to. And one of the easiest things that I always tell males is, please do not sit with a laptop on your lap. I know that that's the name of the computer, but males should not keep their laptop on their lap. It should always be on a table, especially as those laptops can get hot. If you have a male who works all day long on his computer, constantly heating of the testes is not going to allow for that normal sperm development, and that could be just one of the easiest fixes to help that man with infertility. So again, here's another picture, a different way to look at it. Now you're seeing the cord that is completely enclosed with that cremaster muscle surrounding it, allowing it to move the testes according to the temperature, so we can always keep it, remember, 1.1 degrees Celsius lower than body temperature. The pathway of the sperm, whenever I talk about this, I'm going to liken it to a water park ride. So there's going to be 7 different parts to this water park ride. If you've never been on a water park ride, then oh my goodness, you must go this summer. They are so fun, but there's different parts of the ride where you move in different directions and you may go up or down or around in a circle. And then there's also parts of the ride where you have these gushes of water that come out in massive force, just to kind of help make sure that the people can continue to slide down the slide so that it doesn't dry out. So when we talk about the pathway of the sperm, I'm going to liken this to the water park ride to help you with your learning so that it makes a little bit more sense for you. But when we talk about those water gushes, just keep in mind that those are going to be from the accessory glands. So we have this duct system that the sperm is going to take, that's going to be the pathway, but along the duct system, we're going to have accessory glands that will help secrete the fluids or that extra burst of water into the system so that that sperm can continue to go on its wonderful little ride. So if you use this picture, I highly encourage you to go in and number the different parts of where to start on this water park ride so that it can help you with your learning process. There are going to be word slides that will put the number next to the structure. So as you're learning this and I talk through the different word parts, I highly encourage you to go back on this particular picture and the next picture and just number those different things so that way you can see, oh, okay, this is the way that the sperm is actually going to travel in this duct system in order to make it out of the body. Here's your slide for your accessory glands. Remember, these are the ones that are going to provide some extra bursts of water along the water park ride. This is a different way to look at it, so this is going to be a frontal section. So again, you can still see some of those glands as well as different parts of the duct system. So just taking a different approach to it, because our first picture was a mid-sagittal section, and now on this picture you can actually see this frontal section. So two different ways to view it. Whichever part you like best, feel free to use that. So before we can even get on the water park ride, the first thing that has to be done is the sperm have to be made. There's no way for them to get on this pathway if we don't have any sperm to begin with. So we're going to basically look inside of the testes and see how sperm are going to be formed. Inside of the testes, you have these septa that will subdivide each testes into what we call lobules. Inside of the lobules, you have about 800 seminiferous tubules. These are the sperm forming factories, the seminiferous tubules. So each one is about 80 centimeters long, and we have nearly 1/2 mile in each testes within the males, which is amazing and mind-blowing if you even think about it. 1/2 mile of seminiferous tubules inside of a male, like that's so cool to me. They connect to the rete testes, which is a network of interconnected straight tubules, and ultimately they're going to go through the rete testes to end up into the epididymis. That epididymis is going to be the first part of our water park ride. So let's make these sperm so that we can then get on that ride. Looking at the seminiferous tubules, what you can see is on the microscope slide in this particular section, they look very much like a kiwi. So you have these round circles, you have some clearer areas on the inside, and then where the kiwi seeds are, there's lots of different cells that you can see. So this is just to kind of help you whenever you're in lab. As you look at the microscope slide, sometimes I know it's hard for people to understand what they're looking at. So remember the kiwi. If you see something that looks like the kiwi, you're looking at a seminiferous tubule. You guys are going to go to the water park and eat kiwis, and you're never going to think the same ever again. But that's good. That's how you make your learning really stick. All right, so whenever we look at those seminiferous tubules, keep in mind that there's going to be areolar tissue that fills up the spaces between the tubules. So within those spaces, we're going to have blood vessels, but we're also going to have these cells that are called Leydig cells, or also known as interstitial endocrine cells. So interstitial, in between the tissue. Interstitial endocrine cells, or Leydig cells, are the cells that are so important. Star it, highlight it, box it, underline it, because these are the ones that are going to produce those androgens. So testosterone is the most important androgen. It's going to come from these Leydig cells. Instead of remembering it as interstitial cells, I highly encourage you to remember it as Leydig cells, because when we start talking about the hormones that will stimulate the Leydig cells, you're going to easier remember what's happening if you remember the word Leydig starting with an L. Just trust me on that, okay? So Leydig cells produce androgens. Testosterone is the most important androgen. The testes produce immobile sperm. Immobile sperm, not yet capable of fertilizing an oocyte. So we've got other parts of the reproductive system that are going to be responsible for the maturation, the nourishment, storage, and even transport of that sperm. So the immobile sperm from the testes get moved by the cilia that line the efferent ductules into what we call the epididymis. So the epididymis is the first part of our water park ride. That's why you see the number 1 there. Go back to your picture and make sure you label in the testes, this is where the seminiferous tubules are. The seminiferous tubules is where you make sperm. Outside of the tubules, you have the latex cells, which make testosterone. Okay? Functions of the epididymis include monitoring and adjusting the composition of the fluid that is produced by the seminiferous tubules. And here, you will not only store and protect sperm and help them to get functionally mature, but this is also an area where any damaged sperm are going to be recycled. We're not going to let people who are too short to get on the water park ride get on the ride, because it will be too dangerous and it could lead to problems later on. So this is the checkpoint, you know, where the lifeguard has the measuring stick and they tell the kid, look, if you don't reach this point on the measuring stick, then you can't get on this ride. It's for your safety. That's what's going to happen right here. So first step, as we're trying to get on this ride within the epididymis, there's going to be a checkpoint, and anything that is not normal is going to go bye-bye. Not going to allow this to get on the ride, because we do not want to use a damaged sperm to try to fertilize an oocyte, because then we're going to end up with a damaged embryo, a damaged newborn. That's never going to be good. So the epididymis is wonderful in that it does that, as well as making sure that the sperm that end up here have reached their functional maturation before we move forward into the next part of the slide. So next part, number 2, is going to be the ductus deferens, also known as the vas deferens. In this particular duct, you're going to see that it's lined by PCCE. Of course, we all know that structure and function always go together. So there is a reason why anatomy and physiology get taught together, because anatomy is structure, physiology is function. So anatomically, the way that something is set up is usually done in order to help facilitate its role or its function. Whenever we look at the ductus deferens, the fact that it's lined by this PCCE means that we can use the cilia to help move the sperm. So there will be contractions as well that help propel that sperm as well as the fluid. In this part, sperm can be stored for several months. So if it is a male who is not doing anything sexually, no activity whatsoever, then his sperm can stay stored here within the ductus deferens for a few months. If it's not utilized, it's going to ultimately end up being recycled into the body. He's always going to be making new sperm. So he makes new sperm daily, so that's always a good thing. The ampulla of the ductus deferens is structure number 3. So if you go back and you look at your picture, the ampulla is basically the end point of the ductus deferens that you're going to see on the posterior aspect of the bladder. It will combine with an accessory gland. Remember, the accessory glands help secrete the water burst, so they're going to be for fluid purposes. It'll combine with the accessory gland to create what's called the ejaculatory duct. So the ejaculatory duct is step 4 of the water park ride. So we've moved from the testes, up the ductus deferens, around the ampulla, and now we're getting into the ejaculatory duct. The ductus deferens is the structure that is cut whenever you have a vasectomy. Vas deferens, vasectomy. Because of this, sperm are still going to be produced, because remember, where does sperm get produced? In the testes. So there will still be production, because the testes will still make the sperm will still move over into the epididymis, but it's the ductus deferens that is cut. So even though he makes the sperm do not get to go beyond step 2 on the water park ride. They never come out at the end. Instead, what happens is they get recycled back up by the body. Now, the urethra is going to be the next few steps of our water park ride. We ended up in the ejaculatory duct, and now we're going to move through the very long male urethra. So the urethra is about 20 centimeters as you move from the bladder to the tip of the penis, and we divide it up into 3 different sections. Prostatic, membranous, and spongy are going to be the 3 different sections, and those are the ways that the sperm will move through the urethra. First prostatic, then membranous, and then spongy, and ultimately will get out of the body. The accessory glands will secrete fluids into the duct system. Remember, this is the water park bursts of water. So we have 3 areas where there will be bursts of water. The seminal, prostate, and bulbourethral glands will help us with those water bursts. Obviously, it's not water, it is fluid. We'll talk about what's in the fluid. The major functions of these accessory glands include activating sperm, making sure that they have the nutrients that they need in order to swim on their very long journey, because even after they've gone through the entire water park ride in the male, remember, they still have to come out that external urethral orifice, and then in order for procreation to occur, they have to move into the woman's vagina, up into the uterus. I mean, there's still a very long way to go for those sperms. They're going to need lots of nutrients. The accessory glands also help with propelling the sperm because of peristaltic contractions. So although they can swim, it's nice to have, the waves that help you go in the direction that you need to go in. And the accessory glands will also produce buffers, and that is because the vagina is naturally acidic. It should be naturally acidic because if it is too alkaline, it is much easier to catch a bacterial infection. So it has to be acidic in order to maintain its normal homeostasis. So these accessory glands will produce buffers that will counteract the acidity of that vaginal environment in order to allow the sperm to kind of swim on through. First one is the seminal gland or the seminal vesicle. This is extremely active. This is going to produce the majority of that semen volume, so 60% in total. And this will provide the fructose for those sperms so that they have plenty of energy on this very long journey that they're going to have to go on. Again, the alkaline pH is there in order to help with the buffering of the acidity. The prostate, incredibly important in males. This prostate is going to be inferior to the urinary bladder, and it will secrete prostatic fluid. Now, this fluid is going to be about 25% of the semen volume, but it's very rich in enzymes that help make sure that the sperm don't coagulate in the vagina. They cannot clump together, or else they are not going to be able to get to that oocyte. So this will help with that. It's going to also be problematic if a male has anything that's going to cause inflammation in his prostate, not just for reproductive function, but this can also affect urinary function because of the location of the prostate in relation to the bladder. So this will encircle the prostatic urethra, and if it becomes swollen and inflamed, it can start to constrict that urethra, which means the male can have problems with peeing. He may experience pain, he may experience dribbling, things of that nature if that prostate is inflamed. In addition to the urinary symptoms, he may also get something like back pain or mucus discharge from his penis. This can occur at any age, but it's most common in older men, and it's very important because men are more prone to not go see the doctor and they want to wait until the very last minute before they get checked and seen. It's very important to learn how to have great bedside manner with men because they tend to feel more uncomfortable, and a lot of times Some men are only there because their wife forced them to be there. They don't even want to be there. But she said, you must go. She made the appointment. She forced them to be there. So got to be very gentle and delicate with men, even though we all think of men as very strong, in which they are very strong, burly, but have to be cautious in how you treat them so that way they do feel comfortable. If it's a situation where it's bacterial, then antibiotics might be able to help with the bacterial causes and reducing that inflammation. Diet can certainly play a role in this as well. So making sure that he understands what are anti-inflammatory foods, what can he eat to support his prostate. I'll tell you a true story. One of my very favorite doctors that I used to listen to speak all the time, I would go to as many of his seminars as I could because he was an amazing teacher, ended up being diagnosed with prostate cancer. Now again, he's a doctor, he's a male, he knows, he should have known better, but like I said, they don't like to go in until the very last minute. So by the time his prostate cancer was caught, he was in the very last stages, and he did not have a lot of time left, which was an incredibly sad situation. And I came home and I told my husband about it, and I was so upset about it. And I told him that I needed him to start eating tomatoes every single day because I know they support the prostate gland. And even though he didn't like tomatoes, I needed him to eat the tomatoes because I did not want him to ever have to go through the same thing. So he told me, no way, I don't like tomatoes. I mean, you can give me some ketchup or something like that, but I am not going to eat the tomatoes. And I'm like, look, it's important, it's necessary. And he's like, I'm not doing it. Tomatoes, sauce, spaghetti on something like that, but no, I'm not just going to eat tomatoes. So I kind of won the war, even though I lost the battle, because God has a wonderful way of working, and he put someone in my husband's path. As my husband went to a client's house about 2 weeks later, he was talking to this man. My husband is a chatty Cathy, and he loves talking to people, which is so great. He was asking him what was wrong because he kind of saw him limping around a little bit, and the man told him that he had just recently had his prostate removed because of prostate cancer. And so my husband, of course, I'm sorry to hear that, and that's awful. And the man told my husband, do what you need to do to take care of your prostate. I had to have mine removed. Did you know that if you have your prostate removed, it is possible for you to lose up to 2 inches on your penile length? At that point, my husband was so blown away. He came home, told me, babe, tomatoes every day. I will eat whatever you tell me to eat. I will do it. I promise you. You put them on my plate and they're going to be gone because I cannot afford to lose 2 inches. And so we just laughed, and I thought it was the funniest thing. But at the end of the day, it is important to be proactive and be preventative. So that man taught my husband a wonderful lesson that I really couldn't get through to him, but I am very grateful that he did. So now every day, whenever we have the tomatoes, we always joke. And we have sons, and so they know that that's their prostate medicine. Tomatoes are very rich in lycopene, and that lycopene is very healing and very nutrient dense for that prostate gland. So a lot of pictures, even if you look at anatomy lab manuals and books, the prostate very often will be red, and it will look just like a cherry tomato. So there's no coincidences in what is good for us that is found in nature, how it is very similar to our body. All right, those bulbourethral glands, the calpers glands, these are going to be located at the base of the penis, and they secrete this very thick alkaline mucus. This lubricates the tip of the penis, so this is what somebody may sometimes refer to as the precum. That lubrication comes from this particular gland. This gland will help with neutralizing the urinary acids in the urethra, because if you look at the setup of the males, the same structure is going to be used for sperm exiting the body as urine exiting the body. It is not that way in females, but in males, this urethra is going to be the passageway for the sperm as well as the urine. So I really appreciate the fact that this gland is within the males, because it helps kind of neutralize those urinary acids, clean things up a little bit as it is working. So I appreciate the fact that that was included. The seminal fluid is the same osmotic concentration as blood plasma, but it has a little bit of a different composition. So we are going to have higher concentrations of fructose, again, because the sperm need that for energy. And then you will see prostaglandins here. These will stimulate smooth muscle contractions in both male and female reproductive tracts. So the prostaglandins, the fact that they will stimulate the smooth muscle contractions, again, if we use our physiology to our advantage, women who are pregnant and they are close to their due date, or maybe even a little bit beyond their due date, a few days beyond, I will often tell them, if you can have sex, have sex. And the reason why is because those prostaglandins will stimulate that smooth muscle to start the contraction process. So it is good for a woman to have sex with her husband while she is pregnant. That's still a healthy thing, nothing wrong with it, nothing to be freaked out about, but especially good if that baby is acting like it doesn't want to come. So it's just one of those ways to kind of naturally induce that when the time has arrived and the baby still is acting like it doesn't want to move. So prostaglandins will help with that contraction process. The secretions of the seminal glands, remember, are slightly alkaline, and remember, it's because it's to neutralize the acids both from the prostate as well as the vagina. Semen is what gets ejaculated. Typically, this is going to be 2 to 5 mils. An abnormally low volume can indicate problems either with the prostate or with the glands. So got to go and do a little bit more detective work to see what's going on with that patient if he's having a low semen volume. A sperm count will be taken of semen collected after 36 hours of abstinence. So normal range should be 20 to 100 million sperm per milliliter. Again, this is another good thing to evaluate when you have couples who are dealing with infertility, because although people usually think that it's a problem with the female, sometimes it's an issue with the male, sometimes it's an issue with both of them. But it's always good to have a sperm count and to know, is his volume accurate? Is his sperm number accurate? Are we in a level where we are actually going to be able to, hopefully get a good result here? When we're looking at semen, it contains sperm as well as seminal fluid as well as enzymes. The penis is that organ that is going to conduct urine to the exterior as well as allow the sperm to get out of the male's body and then introduce semen into the female's vagina. If we're looking at this picture here, you can see the purple structures are called the corpora cavernosa, and these are the dorsal columns of erectile tissue within the penis. Now, if you are wondering, why did I just say dorsal, even though that looks like that's the front of the penis, make sure you take a note right here to keep in mind that when we're talking about dorsal and ventral in regards to the penis, we're talking about it in its functional anatomical position, which would be erect and straight up, not flaccid and down. So if it's erect and straight up, then that means that those purple columns are indeed dorsal columns that are closer to the back, and that singular ventral column is called the corpus spongiosum, which is continuous with the glands of the penis. In this particular picture, this male has had a circumcision, so you do not see any foreskin on his glands. If he had foreskin, you would not be able to see that external urethral orifice. So the foreskin is also known as the prepuce. This is just a fold of skin that surrounds the tip of the penis and continues over the glands, kind of what I just discussed. In the area here, you will have these glands that will secrete this very waxy material that can harbor bacteria. So it is very important to ensure that if a male is not going to be circumcised, that he understands how to clean appropriately so that he does not get bacterial infections. Circumcision is the removal of that foreskin, usually done within the first week of a baby's life, and it will help with preventing infections and potentially even penile cancers. It's not done on all males. Sometimes it's done for health reasons, sometimes it's done for religious reasons, but there are many males who do not get circumcised. If you get circumcised as an adult, it is incredibly painful. So if you're going to have kids and you're going to have a baby boy, then I highly encourage you to really consider it and think about it. I do know someone who got circumcised at 36 years old, and it was incredibly painful. It took him down for about a week, even though this is a very strong guy. One of my friends' boyfriends, and he just was so upset that his mom just didn't do this whenever he was young. So just keep that in mind as you're debating on whether or not circumcision is going to happen with your baby boy. Erectile tissue in the resting state means that we have arterial branches that are constricted and blood flow is restricted. During the erection, what happens is the penis will stiffen and elevate into an upright position as we have the opening of those arteries, and blood can easily flow into the tissue. So again, if we look at it from this frontal section, you can see the corpus spongiosum and the corpus cavernosum are those erectile tissues that blood is going to be filled, and it's going to engorge, it will stiffen, it will become hard, and then that will allow it to stand up. Looking at it from a sectional view, you may even also see something like this in the lab, where you are going to be responsible for identifying where is the corpus cavernosa, where is the corpus spongiosum, and one of the keys that I tell my students is always look for the urethra. And that urethra, if you find it, then you will know, okay, I know the urethra is in the ventral column of the spongiosum, so that helps you get your answer. The urethra is always not a perfect circle, so very often it looks very weird, like a tree branch almost, kind of. So don't expect it to look like a perfect circle whenever you're looking at it underneath the microscope in the lab, but that's one of the clues that you can utilize to help you with identification on that penile slide. Okay, so now we're going to move into the actual process of creating these sperms. So now that we've talked about, where they get created, which is within the testes, and how they're going to get out of the body, which is through the duct system, we need to talk about how are they actually formed and what is the process that occurs in order to make these sperm. Star that it begins at puberty. Okay, because that is not going to be the same for oogenesis in females. So it begins at puberty, and star that it continues past age 70. Because again, not the same for oogenesis in females. So start at puberty, continue past age 70. This is why older men still have the ability to have kids, because they continue to create sperm well beyond 70 years old. This whole entire process will take about 2 months. So in 2 months, this whole thing should be completed. There are 3 steps that are going to be involved in this process, and we always first start with mitosis, then move into meiosis, and then go into spermiogenesis. Anytime you see that word genesis, just think about creation. That's what Genesis means. So it's even the first book in the Bible, Genesis, creation. So spermatogenesis is going to be the creation of the sperm, the whole entire process. But it's got 3 major steps that it has to go through. Step number 3 is called spermiogenesis. So it's going to be very important as you learn this to differentiate between, although those words are very much alike and there's just a few letters of a difference, what is the difference anatomically and physiologically? So that's what I'll teach you. When we're looking at spermatogenesis, we first start with a stem cell. Remember, a stem cell is that cell that can become anything. The spermatogonia are going to be the stem cells that start off this process of spermatogenesis. Remember, step number 1 is we got to use mitosis. So it's going to divide by mitosis to produce 2 daughter cells. If you remember mitosis from biology, you know that mitosis will give you basically an exact replication. And that's what we're going for in mitosis, always an exact replication. So we're going to get 2 daughter cells that are exactly alike. One of those is going to remain a spermatogonium. It's going to stay a stem cell so that we can always continue to do this process over and over and over again. But the other one is going to differentiate into what we call a primary spermatocyte. So that primary spermatocyte is going to be the cell that will go through the process of meiosis. Remember, meiosis is only for sex cells. So the E in meiosis goes with the E in sex, S-E-X. Meiosis is not going to give an exact replication. The whole goal of meiosis is to give us half of what we originally started with. So, very important to know the difference between the two and how we're ultimately going to end up with half of our chromosome number in our sperm. The secondary spermatocytes are going to differentiate into spermatids. Spermatids are going to be the things that are going to differentiate into sperm, and then sperm are ultimately going to go through a process, the last step of spermatogenesis, which is called spermiogenesis, in order for us to get our sperm. So I'm going to use pictures to kind of walk through this entire process so that I can show you how spermatogenesis occurs and how we can get sperm through this process in the male. So starting here, remember we start with mitosis. That is step number 1. We're producing 2 daughter cells. So the spermatogonium is going to undergo mitosis and it's going to give us 2 daughter cells. The one that you see going off with the arrow to the right remains the spermatogonium. Okay, it has to stay there so that we can continue to do this process multiple times throughout his entire life. The one that is going to differentiate, which means change, which means it's going to become something, that's the arrow down. It's becoming the primary spermatocyte. Okay, diploid 2N is going to be that we have 2 pairs of chromosomes. So this is not going to work in order to give us a child, because we do not want 2 pairs of chromosomes. We do not want diploid. So what's going to happen is that primary spermatocyte is going to go through meiosis. And what's going to happen is it will divide, and each of those divisions is going to give us what we call secondary spermatocytes. Each secondary spermatocytes will contain 23 chromosomes. However, they're going to have a pair of duplicate chromatids. So that's why it still looks like there's a lot of stuff going on inside of that cell. We've got 23, but they've been duplicated. So we need to go further. This is why this is only meiosis 1. We need to go through another stage of meiosis. Meiosis 2 is where we are now going to get 4 spermatids, and now you can see that they are haploid. So each one of those will contain 23 chromosomes, and this is where we are now ready to move this spermatid into an actual sperm, because we have half of the chromosome number. Whenever I am going to make a baby with my husband, I need half of my genetic material, half of his genetic material. So 23 from me, 23 from him. Together we make 46. Now, if we did not have meiosis and it was all of my 46 and all of his 46, then we would end up with a baby with 92 chromosomes, which wouldn't be a baby, it would be more like an alien. Okay? So we have to have meiosis 1 and 2 specifically for sex cells in order to give us our haploid number of chromosomes. The last part of spermatogenesis is spermiogenesis. Spermiogenesis is physical changes that are going to occur to move this from looking like a spermatid into looking like an actual sperm. So now you can see this looks more resemblant of what you know a sperm to look like, whereas that spermatid just looked like a circular cell, and that really did not have the ability to fertilize anything. So spermiogenesis is definitely required so that we can have an actual functional sperm. You can see here, this is the differentiation process as we move from a spermatid into a sperm. This process normally takes about 24 days, so a little bit less than a month in order for us to move through the spermiogenesis process. So do not get confused between spermatogenesis, because spermatogenesis is the name for the entire process, steps 1, 2, and 3, in order for us to get 4 sperm. Spermiogenesis is just the differentiation of spermatid into sperm. So it's just that last step in the process. You can see here that as it goes through this process, it is changing shape, but it's also shedding cytoplasm and losing some organelles, which is incredibly important. So what we want in a sperm is a head, a neck, a middle piece, and a tail. Mature sperm need to lack certain factors like ER, a Golgi, lysosomes, etc., etc. We lose the organelles, reduce the size and the mass. So why would this be important? If you think about it, remember, structure and function always work together. Why would we need to change the structure and lose all of these things? It's because of the function. The sperm has a very long way to go. We've already gone through the water park ride, but remember, it still has to go through all of the different structures inside of the female. So losing those organelles, reducing the size as well as the weight, allows that sperm to go on its journey without being heavy and overburdened and needing to carry all of this baggage. So that's why it's very important. The sperm are going to have the ability to absorb the nutrients from the surrounding fluid in order to help them on their very long journey. When you look at the sperm, at the head you have what's called the acrosome, which is incredibly important when it comes to fertilization. So the acrosome has to be at the head because that will be responsible for what we call the acrosomal reaction as it tries to penetrate into and fertilize an oocyte. And then right there in the head you also have the nucleus, which is going to have all of the genetic material that is going to be necessary to combine with genetic material in the oocyte from mom in order for us to get a 46 chromosome child. Of course, you can see there in the middle piece you also have the mitochondria. Makes sense for it to have that much mitochondria because it's going to need a lot of ATP. And then the tail is a flagellum. This is the only place in the human body where you will see a flagellum. So this is a very specific structure, specifically meant for a whip-like motion to allow that sperm to move and to have great motility as it goes on its long journey. So more information in words for those of you who like words on the next few slides, basically what I've described in the picture. Okay, so whenever the sperm leave the epididymis, they are mature but immobile. In order to become motile, they have to undergo capacitation. So capacitation is when the sperm become motile because they become mixed with secretions of the seminal glands. So remember the accessory glands that we talked about with the water bursts. The sperm become capable of fertilization when they are exposed to the female reproductive tract. And again, that acrosome at the very tip of the head of the sperm is going to be important in order to help penetrate the corona radiata, which is a structure that is around that oocyte that the sperm are going to have to get through in order to actually fertilize that oocyte. following slides go through a greater detail of what was discussed in the pictures for the process of spermatogenesis. So again, if you like the words, then you can take some time to read through those things. But it just says what I was saying as I gave you the information for how spermatogenesis actually occurs in order to get 4 haploid sperm in a male. Okay, so remember that the sperm are going to be produced inside of the seminiferous tubule. Remember also that outside of the seminiferous tubule, you have some cells that are called what? Leydig cells. The Leydig cells are going to be responsible for what? Androgens, namely testosterone. So when you look at the seminiferous tubule, on the inside of it, these are some things that you will see inside that tube. You'll see the spermatogonia, which is the stem cell that we started with to allow the process of spermatogenesis to occur. You'll see the spermatocytes within the various stages of meiosis. You'll see the spermatids, the sperm, but you'll also see something we haven't discussed yet, which is called a nurse cell. So if you look at this picture, you can see the nurse cell has been starred, and the nurse cell is basically on that outer edge of the tubule. Okay, the process of spermatogenesis, as we walked through step by step, 1 is mitosis, 2 is meiosis, 3 is spermiogenesis. The process actually occurs in a very systematic way where you're looking at the tubule, and the first few stages occur near the wall of the tubule, and as the spermatogenesis process progresses, it ultimately is going to move towards the lumen or the center of the tubule, which is why you will see sperm closest to the lumen, but you do not see any sperm at all near the wall of the tubule. So instead, what you see near the wall are the nurse cells. And the nurse cells, think about it as what a nurse would do. A nurse is incredibly important as they take care of patients. They support them, provide nutrients to them, ensure that everything is okay. Is it time for prescription medication? All kinds of things that nurses do on a regular basis in order to support and help that patient. So the nurse cells within the seminiferous tubule are going to support and help the spermatogenesis process. Okay, so that's what they're there for. Again, the interstitial endocrine cells that you see circles, remember, those are on the outside of the seminiferous tubule. And if you do not know the answer to what hormone is produced by this cell, then you know that you are not listening to me, and it might be time to shut it off and take a break, and then come back to it. Alright, nurse cells are also called Sertoli cells. They play a very important role in spermatogenesis because they're going to do these things. They're going to maintain the blood-testes barrier, so you have heard of the blood-brain barrier. We know that the blood-brain barrier is going to keep the brain protected, so blood-testes barrier is going to also provide protection. The nurse cells will help maintain this. Support mitosis, meiosis, and spermiogenesis, which are the 3 processes of spermatogenesis. And then it will also secrete inhibin as well as androgen binding protein, ABP. So we'll talk about each of these things in greater detail. The blood-testes barrier will isolate the seminiferous tubule from general circulation, again, to keep things protected. So the way that the nurse cells do this is tight junctions. The tight junctions will divide the seminiferous tubules into compartments, and we want to make sure that, remember, if it's a tight junction, it's very hard for things to go in tight junctions, things that are not supposed to be in. We do not want to interfere with the process of spermatogenesis and create a lot of deformed or irregular sperm. Okay, so that's why it's very important to maintain this barrier, because we don't want outside toxins or chemical exposure interfering with the production of the sperm. Supports mitosis and meiosis because nerve cells are stimulated by FSH and by testosterone. So if you remember back to the endocrine system, the FSH, the follicle stimulating hormone, goes to both males and females. So if it is going to go to the testes in the male, then it will stimulate the nurse cells. The stimulation of the nurse cells will promote that spermatogenesis process. So the hormone will come in as FSH. Remember, where does FSH come from? Anterior pituitary. So from the anterior pituitary, it's going to go all the way down to the testes, talk to the nerve cells and say, hey, it's time to do spermatogenesis. Remember, the last step of spermatogenesis is spermiogenesis. So in spermiogenesis, we have the spermatids being transformed into what we would say that's a normal sperm. And as they lose that cytoplasm, the nerve cells will help phagocytize that cytoplasm and basically act like a cleanup crew. So we all know that nurses have to do some really gross stuff in cleaning up patients whenever they're getting rid of materials. So that is one of the jobs of the nerve cells, is to help support that process of spermiogenesis. The nerve cells will secrete inhibin in response to factors released by sperm. So inhibin sounds very much like inhibit. So think about it that way if that helps you, because the inhibin will depress pituitary production of FSH and maybe also even the GnRH. Remember, GnRH is gonadotropin releasing hormone. If the releasing hormone signal is sent from the hypothalamus down to the pituitary, then the pituitary knows it needs to basically release the FSH or LH. So inhibin is going to be the negative feedback mechanism that says, look, we've done spermatogenesis, we've got a lot of sperm, we're good, we don't need to continue to do this right now, okay? Because negative feedback is important. We already get a lot of sperm on a regular basis in a male, up to 500 million, so we don't need to continue the process and give him 3, 4, 5 billion sperm a day. So inhibin will help regulate and control this process. As rates of sperm production increase, the secretion of the inhibin will increase. If that doesn't make sense to you, go back and re-listen to this slide again so that you can understand that negative feedback mechanism that helps with the balancing of the spermatogenesis process. Nerve cells will also secrete ABP. This will help bind androgens, specifically testosterone, in the luminal fluid of the seminiferous tubule. Remember, males need testosterone in order for their homeostasis to work like it should, so this is important for making sure that we can elevate the androgen concentration and stimulate that spermiogenesis process within the male. The production of ABP is also stimulated by FSH, so that same hormone that is coming from the anterior pituitary. Hormones and male reproductive function. This is just a reminder slide. There isn't anything new on this slide because you should already know. Excuse me, FSH and LH are going to come from the anterior pituitary gland because of the GnRH released by the hypothalamus. So both FSH and testosterone are going to target the nerve cells of the seminiferous tubules. And again, the nerve cells will secrete inhibin, ABP, and then promote spermatogenesis and spermiogenesis. So let's talk about the luteinizing hormone for a second. because the luteinizing hormone is what is going to target those interstitial endocrine cells of the testes, also known as the Leydig cells. So that's why I told you to remember it starting with an L, because if you remember the Leydig cells start with an L, they are going to be under the influence of luteinizing hormone, which starts with an L. So luteinizing hormone, or LH, will come from the anterior pituitary, go down to the testes, and stimulate the Leydig cells in order to induce secretion of testosterone and other androgens. Testosterone is incredibly important in maintaining male sexual function. It will basically make sure that the male has those secondary sex characteristics that we are so familiar with in regards to a male. It will function like other steroid hormones, and it will diffuse across the target cell membranes and bind to intracellular receptors. Okay, so because it's going to be that steroid hormone, it can get inside of the cell and bind to intracellular receptors. The testosterone will stimulate spermatogenesis, as I just said, so both FSH and testosterone can stimulate that. It will help maintain libido and other related behaviors of male sexual drive, stimulates bone and muscle growth. Again, like I just said, those secondary sex characteristics, whether it's a beard, mustache, super big muscles, whatever it is, that is testosterone driven. And then it will help maintain the accessory glands that we discussed, and then other organs of the male reproductive system. So very important for males to have sufficient amount of testosterone so that they not only feel and look like a male, but they also feel very comfortable in their own skin. Some testosterone can be converted to what is called DHT, dihydrotestosterone. Some DHT can diffuse into the bloodstream, and it has the ability to bind to the same receptors as testosterone, and some tissues will actually respond to DHT instead of testosterone. The other thing is that within males, they will also have small amounts of estradiol. So that would be the estrogen hormone that we're used to hearing about inside of females. 70% of this estradiol can be formed from circulating testosterone. So if you go back to the endocrine PowerPoint where I gave the cholesterol biochemical slide that showed you how testosterone and estrogen and progesterone all come from cholesterol, you can see that it is possible for testosterone to be converted over into estrogen. This is done by what's called aromatase. It's an enzyme that can make testosterone convert over into estrogen. Some males have a higher rate of conversion, which tends to actually increase as a male gets older and his testosterone levels naturally drop. But one of the culprits behind this conversion is the standard American diet. Because the standard American diet is, again, high in unhealthy foods, those foods can cause the conversion from testosterone into estrogen, which is not beneficial for a male. When you see males who start to develop gynecomastia, so that is male breasts, they start to increase in weight, then we're going to be looking at a male who has a conversion issue where his testosterone is getting shifted over into estrogen. So in order to help stop that, there are foods that are called aromatase inhibitors. That is something you can Google and look up. There are lots of different healthy foods that are aromatase inhibitors that keep that conversion from moving from testosterone into estrogen. But again, incredibly important for that male to eat things that are going to help with not only testosterone production, but the stopping of the conversion. And whenever we eat foods that are high in hormones, like those very low quality meats that I talked about in the endocrine PowerPoint, those things that have been injected with the estrogen in order to help make them fatter and grow faster, that is then going to come into the male. So if he's eating low quality meats and he's exposing himself to much higher levels of estrogen, that is one of the first things that needs to stop if he is trying to get his testosterone levels under control. He has to have a healthier diet. And the last thing that I'm going to leave you with is this. One of my favorite guys to listen to is Jim Gaffigan. I absolutely love Jim Gaffigan. He is hilarious. And laughter is medicine. So this clip is great, and it goes right along with the reproductive system in males because of some of the things that he talks about. So I do encourage you to take a little brain break, listen to the clip. If the embedded video is not working, then there is the YouTube link for you so that you can enjoy that message from Jim Gaffigan.